Good day. Nice to have you visit once again. I would like to talk with you today about the death machinery of the NHS. You may think that title is exaggerated. I would beg to differ. I heard a snippet on the BBC Radio 4 Today programme about foreign-born nurses being given training on CPR techniques. For those who have not come across this term, CPR is the acronym used as a short form of cardiopulmonary resuscitation. This describes the various approved forms and practices of attempting to restart a patient's heart rhythms after a heart attack. There are two main types of CPR. One is very physical, with the doctor or nurse bending over the patient and after firstly clearing the airways and administering rescue breaths to the patient. They then administer chest compressions at the rate of approximately 100 per minute, then more rescue breaths, and then more compressions. The second technique, which usually follows on from the first, is using a defibrillator if available. It is the more updated approach with a shock to the heart muscles designed to interrupt the quivering of the patient's heart muscles and bringing back a steady rhythm to the heart. This, together with an epinephrine injection, is both well known and well understood in NHS hospitals. Now, this is okay in one respect, but as these people are already supposed to be fully trained, it must be presumed that they already know these steps, and it's just a refresher course. But, and there always is a big but with our so-called beloved NHS, the patient's file must be scrutinised before any further remedial actions are begun, because the hospital death panel, comprised of senior medical people and consultants, will, upon admission to the hospital wards, would have already decided if that patient lives or dies. But forsooth and nay, may I hear you cry. Surely the hospital, the NHS hospital, is where the staff strives to heal and cure all the many medical problems and injuries which land people in the hospital. Not so, my friend, because the consultants and senior medical people have their own standards for the treatment of things like heart attacks, and those standards are very, very far away from those of the patients and their families. When those senior medical people look at the patient and their medical file, they ask themselves one very basic question: is there a realistic chance of the patient's survival? There is a complex document already filled in which answers that question. That document does one thing and only one thing. It uses statistics, bloody statistics, in determining whether the head of a heart attack receives that cardiopulmonary resuscitation, receives that defibrillator treatment, receives that epinephrine life-saving injection. So, if you are old or frail or your statistical chances of recovery are marginal, you don't need to worry if that foreign-born nurse ever gets a chance to use that cardiopulmonary resuscitation techniques which she was reminded of during her refreshing training, because it's already stated on your bloody file that you will not get it. And why, you might ask, am I so strident? Why do I make this video? Because my wife was in hospital for an operation to repair a fractured hip. She was frail. She could not speak properly. And all the warnings, all the discussion with the family members, which is talked about so much in that bloody document, was a 5-minute monologue over the phone from some hospital clown who kept droning on about how some people's life chances were poor if they had been given CPR. I was never informed. I was never told, and I shall never forget what they did to me and to my beloved wife. I thank you for your visit, and I hope to see you again.